Hey guys, it's me again. It's day 4. I'm here drinking my detox drink. You're supposed to drink it through a straw because the lemon juice is particularly bad for your teeth. So today I wanted to talk about the symptoms of a candida overgrowth, candidiasis, or what you would call a gut flora imbalance. So, as specified in the book, the current list of symptoms are recurrent yeast infections, which we've talked about, but that can include oral thrush, which is yeast infections in your mouth, obviously vaginal, and then men also can get yeast infections generally from their partner. However, it can happen anytime, anyway. And you can also get skin and nail infections that are due to candida overgrowth and yeast. So if you're having like weird toenail fungus, you could potentially be having a candida fungus, who knows? Also, in addition to that, I talked about fatigue a little bit yesterday. And so in here they specify mental health as a big component of a candida overgrowth symptom list. So some things they talk about is brain fog, poor memory, lack of focus, dizziness, poor coordination, depression, panic attacks, headaches, irritability, extra emotional, anxiety, fatigue, and insomnia. So that's like a huge list, right, of like mental health problems. Some people have anxiety, from a young age and are on medication for that. But I would say generally, if you're talking about mental health and well-being, you should see how severe your symptoms are with that. And I only say that because I think that some people have anxiety that could potentially be reduced by doing a different diet, but that may not be the root cause of their anxiety. Now, I don't have a whole lot of anxiety, but I do find that I get brain fog, and I do find that I get fatigued, perhaps without any real reason to be tired. And then, of course, you're tired during the day, but I get insomnia during the night. Sometimes I have a really hard time falling asleep at night. And actually, lately, I've had a really easy time falling asleep, and I'm just on the 4th day. So who knows? Maybe my schedule's changed, so I'm having a better time, but I can definitely say that's improved. So some of the other symptoms, digestion is a huge one. I know I talked about that yesterday, and obviously when you're talking about, gut imbalance, of course it has to do with your digestion. So some of the symptoms are diarrhea, excessive flatulence, weight gain, stomach cramps, constipation, bloating and cramping, acid reflux, which I will get into more later because it's actually really interesting what they talk about in this book. Abdominal tenderness, different cravings for carbohydrates, nausea, and then a H. pylori infection in the stomach. So again, there's some things that you don't quite that you don't even think about sometimes. You're like, I have cramps, or like, I was constipated the other day. That happens all the time. And you're like, it's just a thing. It happens to everyone. Well, it doesn't apparently happen to everyone. Like, surprise for me. I was like, I have cramps sometimes, I'm not on my period and I have cramps. Yeah. That would be due to this problem and not any other, it's not normal, really, is what I'm trying to say. Some more symptoms are respiratory symptoms, asthma, hay fever, chronic nasal congestion, persistent cough, sore throat, flu, and then like a feeling of pressure in the cheeks and forehead is sinus. Now, again, how do you know that is contributing? But I think when you're talking about symptoms, if you have multitudes of the symptoms listed, then that's when you can say this might actually help. But for now, if you have like 1 or 2 things that I've mentioned, maybe this isn't for you. But as I said before, you have to consult your medical provider. I'm not a doctor. Now allergies, I was really interested in this because they're saying food allergies and sensitivities. Now like that could, you know, if you're gluten sensitive and you've been eating a lot of gluten and you didn't know, like having a candida overgrowth could potentially contribute to the uncomfortable feeling that you get when you eat gluten. But you may also be gluten insensitive, not because of the candida. That includes allergy-related asthma, perfume sensitivity, and then frequent sneezing. And again, they're saying, you know, like there are certain sensitivities so sensitivities are not allergies. So like if you're sensitive to some things, you're not necessarily allergic. Like I have a strange reaction to NyQuil. There's a certain component, a medicine in there, it's a cough suppressant that I can't have. I can't have it in anything. It gives me a fever and it throws off my equilibrium. It's a very strange allergy reaction. So we would call that like an intolerance or a sensitivity and not an allergy. So that's something that they wanted to specify in this book. So just because a celiac is someone who is actually allergic to gluten. Someone who has celiac disease will be ill from that. However, someone who is just gluten intolerant and gluten sensitive may just have, you know, like bloating and cramps and not the full Monty, like celiac disease. So that's the majority of what they were talking about. They're also talking about some pain, like different sensitivities to light and muscle pain, arthritis, and easy bruising. Now, my mom has arthritis and so do her friends, and the doctors pretty much across the board recommend a anti-inflammatory diet for arthritis. And this diet has a very similar setup to that diet as well, to the arthritis inflammation reduction diet. So if you have arthritis and you also find that you have other symptoms that I've listed, then you may consider doing this, and it may actually improve your arthritis symptoms as well as your candida symptoms. So that's what they were talking about in terms of symptoms. There is a really handy symptom tracker when you buy the book, and you can you write off the symptoms that you have at the beginning, and then throughout the course of your treatment you check things off and note the changes that happen in your symptoms. So yeah, I just wanted to go over the symptoms for you guys so you can sort of join me if you wish on this sort of journey. Like I said, I had quite a few of these symptoms, yeast infections, which I spoke about, and then I have a lot of the digestive symptoms, and like I said, cramping didn't seem like a big deal until I realized that other people weren't experiencing it. So just an update for today. I haven't had lunch yet, but I had my detox drink this morning. I took my supplements, and then I also had avocado, half an avocado and half a tomato with 2 soft-boiled eggs. I put some red pepper flakes and paprika and salt and pepper on there, and that was my breakfast. And then I'm having another detox drink right now, and I'm gonna have a salad for lunch, probably similar to the one I had yesterday, which was delicious, so I'm not complaining. And then yesterday I decided to add in, instead of doing the detox drink at night, I'm gonna add in a bentonite shake, which is something else they recommended. Bentonite is really great because it binds to the candida, and that's how it flushes them out. And also they're saying that you want to regulate your digestive system here, and I was finding that I was having a weird experience with my digestion, so I decided to add in the bentonite instead of the detox drink in the evening, in the hopes that my digestion will get a little bit more normal. So I've decided that I'm only going to do 5 days on the detox. I think that's right in between the window from 3 to 7 days, and also like I said, my friend is having a party and I want to go and I want to eat something. So I'm done tomorrow. Tomorrow's my last day. and I'm looking so forward to cooking with flour. Obviously it's not wheat flour or white flour, it's coconut flour, but I get to make a version of bread, and that is so exciting. So I can't wait. I'll keep you guys posted, and if you have any questions, please feel free to add in the comments. As well as search me on Instagram. And I'm posting a blog. I'm having a really hard time with WordPress right now, but I'm trying to create a site. So once that's up, these videos will be there, as well as different descriptions and tons more information on the Ultimate Candida Diet. And you can contact me there as well. So thanks for watching. Bye.